Americans living with diabetes. Take heart. Joining us this morning is to talk about the latest advances to help manage the disease, Dr. Steve Edelmann, clinical professor of medicine at the University of California, San Diego School of Medicine. He's been living with diabetes himself for more than 40 years. Good morning, doctor. How are you?
Fine, James. I'm still alive and glad to be on the show.
Well, that's great. So, doctor, what are some of the latest advances for people with diabetes? And what's the difference between type 2 diabetes and diabetes?
Well, basically, in a nutshell, we have type 1 and type 2. Type 1 was formerly called juvenile onset, but you can get type 1 diabetes at any age, and the cause is unknown, but all of those folks have to take insulin. The big epidemic of diabetes is type 2, formerly called adult onset. That's associated with having it running strongly from generation to generation and lifestyle changes. But the most important thing for anybody with any type of diabetes is to keep the blood sugars in a near normal range, avoiding highs and lows. And that's going to reduce all these horrible complications that we read about. Now, one of the tools to avoid those highs and lows are these little glucose meters where people prick their finger, they squeeze the blood out, they put it on a strip, and the meter tells them their blood sugar at that one point in time. And that person with diabetes can be reactive. So for example, if their blood sugar is high, they can take a little extra medication. If it's low, they can take some sugar. Now, the new technology that I want to talk about are these meters that are getting smarter and smarter. So for example, I use the One Touch Vario IQ. Now, it's small, it's convenient, it's easy to use. However, it not only gives you a blood sugar when you test yourself, it also compares that number to all the numbers in this meter over the past 5 days and can recognize patterns and let the user know right on the screen, hey, your blood sugar has been low in the morning 2 of the last 5 days. And then that person with diabetes can actually say, gee, I didn't realize I was getting low on a regular basis. What can I do differently to avoid that low in the first place? It also picks up patterns of high blood sugar. So this is really the first step in allowing the end user, the person with diabetes, to help analyze their numbers and pick up patterns and, very importantly, make proactive changes versus just react to the number as it appears on your meter.
Dr. Edelmann, why is it so important to find these patterns?
You know, it's so important to find patterns because if your blood sugar stays high over a long period of time, it can lead to eye, kidney, and nerve disease and also heart disease. If you don't pick up the low blood sugars, then that can cause a seizure, a coma. You could pass out while taking care of your child or driving your car. So picking up patterns allows people to be proactive, make long-term changes to avoid those extremes in blood sugar that lead to complications on a daily basis and over the long term. Picking up patterns is key. That's where the rubber meets the road with diabetes management.
Now, what are some of the other things people can do to live healthy with diabetes?
Yeah, you know what? I can talk about diet and exercise and all the things that us folks with diabetes are supposed to do. Prick your finger, take shots, go to the doctor, get all these regular checkups. But here's the thing. There are a lot of emotional issues with diabetes, emotional and behavioral issues that disallow one from actually getting their diabetes under control. There's fear, anxiety, guilt, lots of depression in people with diabetes. We don't know why, but we do know there's a higher rate. And I always tell my patients that until you get over some of those barriers, you're not going to be able to take control of your diabetes. So go out, get resources, join organizations, find support groups, read things online and in print, and knowledge is the key to take control of your diabetes.
You know, for example, in my family, we have type 2 diabetes, we have heart issues, we have high blood pressure issues. And here's the difference night and day. I have never taken any medicine for diabetes, for high blood pressure, no heart condition that I know of, but I exercise on a regular basis, Monday through Saturday, go to the gym, hour and a half, do a lot of cardio, lift some weights. No my type of medication. Then I've got a brother who's a year younger than me, and here's a guy that does not go to the gym, takes high blood pressure medicine, takes medicine for type 2 diabetes. He's been diagnosed with type 2 diabetes. So it's hard to get him to get into the gym. Is that where the fear and anxiety and depression comes in?
You know, you're absolutely right, James. I mean, what's the difference from you? You enjoy exercise, you enjoy taking care of yourself, and you feel great. Your brother wants to live a long and healthy life. He's not a non-compliant patient. He might be labeled by his doctor as someone who's not really taking ownership of his condition. So there's a barrier. And I talk to caregivers all the time. Never give up on those patients. Try to get them motivated. But there might be some other emotional issues that your brother has. He might be fearful. He might have anxiety. He may be depressed. And until he gets over those emotional barriers, he won't be able to really take control over his diabetes. So the really key for most people is to get them to put diabetes much higher on their own priority list. And it's much easier said than done, for sure.
Definitely. Dr. Edelman, where can we go for more information?
Yeah, well, information about these smart meters, such as the One Touch Vario IQ, you go to onetouch.com. The website for the organization that I work for, Taking Control of Your Diabetes, tcoyd.org, has lots of good information. American Diabetes Association. Your brother should check out the Behavioral Diabetes Institute, which is a diabetes organization focusing mainly on the emotional and behavioral issues of diabetes. And that's what your brother really needs.
A quick question. Do you have a Facebook page?
Yes, I do.
Well, I'm going to make sure that our viewers go to your Facebook page, and I'm going to go to it right after this, and we're going to make sure we like it.
I'd like to talk to your brother, too. I'd like to help him out.
That would be great. Thank you so much, Dr. Steve Edelman.
Okay, thank you.